Obsessive-compulsive disorder, or OCD, is a disorder of the brain and behavior. It causes severe anxiety in those affected. It involves both obsessions and compulsions that take a lot of time and get in the way of important activities. OCD causes people to become fixated on anything from germs to accidents to injuries. The person attempts to ignore or suppress such impulses. The person also recognizes that the thoughts are a product of his own mind. Compulsions are the repetitive behavior that the person does in response to these thoughts. The behaviors are aimed at preventing or reducing stress, but are unrealistic and sometimes unsafe. It's estimated that about 1 in 100 adults, or between 2 to 3 million adults in the United States, currently have OCD. This is roughly the same number of people living in the city of Houston, Texas. There are also at least 1 in 200, or 500,000 kids and teens that have OCD. That means in a medium to large high school, there could be as many as 20 students struggling with the challenges caused by OCD. This here is Adrian Monk. He is a 51-year-old man who has OCD. He shows no physical ailments or other problems. He has 312 phobias and continues to get more. These phobias range from common fears such as heights and germs to rare fears like milk and mushrooms. These fears keep him from completing everyday tasks such as driving, shopping, and social interactions. OCD rarely disappears spontaneously, and its symptoms may last for years if they are not treated properly. In fact, it is common for a person with OCD to have the problem for 5 to 10 years before seeing a psychiatrist. Getting help sooner can reduce the impact of the illness. Living with OCD has a huge impact on day-to-day life. A simple task like setting your alarm clock or washing your hands may turn into an hour-long task. The most effective treatment is often cognitive behavioral therapy. Antidepressants are sometimes used along with therapy, although medication alone is rarely effective in relieving the symptoms of OCD. Unfortunately, not everyone responds to treatment for OCD. Despite advances in treatment, about 1/3 of people with OCD fail to experience improvement.
My sister suffers from depression. It works that way sometimes. Just overwhelms you.
I didn't really know her. Did you have any family?
Brother in St. Louis, I think.
Excuse me. Excuse me. My name is Adrian Monk, and this is Sharona Fleming, my assistant.
Colleague.
My assistant/colleague.
Colleague/assistant.
I know this is a very difficult time. Just wanted to ask you a few questions.
Are you a policeman, Mr. Monk?
Used to be. I'm a private consultant now. I'm just helping the department with their report. Were you all here when Miss Landau died?
That's right. The students were taking their SATs. We were proctoring the tests.
So you were all together?
No, we were in different classrooms.
Adrian.
Excuse me, what are you doing?
Just making them even.
But you're mixing the regular with the decaf.
But they're even.
But they're mixed together.
But they're even.
But they're mixed together.
They're even.
But they're mixed together.
But they're even. So the test was in progress?
Monk?
Hey guys, we're gonna be here a while, so if anybody's got any homework they need to do, they might as well get it out now.
How long will you be in Mexico?
2 to 3 days.
I'm not a drug dealer.
Pardon me?
I'm not a drug dealer.
Uh-huh. I want you to park over there and meet me inside. Are you opening a restaurant here, Mr. Monk?
No, I'm not opening a restaurant.
He's kind of particular.
We have bottled water in Mexico, Senor Monk. Many fine brands.
Well, all he drinks is Sierra Springs.
Something from the bar?
You have a nice tea. Thank you. Me too, please.
That sounds good.
And for you, senor?
Do you have any Sierra Springs?
No. We have Perrier.
No, thank you. Do you know anyone in town that sells Sierra Springs?
I'm afraid not, senor. We have San Pellegrino.
No, thank you.
We have Aquafina.
I don't think so.
We have Polaris.
No.
Arrowhead.
No, thank you.
Deer Park.
No.
We have Evian. It's delicious, senor. It's our best seller.
It is? No, thank you. I'm sort of used to Sierra Springs.
We have Aqua Fresca. It's owned by the same company that bottles Sierra Springs. They use the same water, senor.
No.
But it's the same water, senor. It's just a different label.
Adrian, same water.
No, I'll be fine.
How long can you go without drinking?
I don't know. What's the record? Just put him anywhere.
Thanks a lot. I see you've want some water.
Yeah. What are you doing?
Thirsty.
No, don't drink that. That's my emergency stash.
You have like 1,000 bottles here.
5,040. Here. Drink this. That's fresher.
As you can see, living with OCD can be very difficult and make everyday situations much harder. Although Monk is a comedy show, the disorder is in no way funny. OCD haunts many Americans every day. There's a wide range of intensities for people suffering with OCD. People with mild cases can typically live a pretty normal lifestyle. However, some cases can get so severe that people can't leave their own house. Most people with OCD fall into one of the following categories. Washers. Washers are afraid of contamination. They usually have cleaning or hand-washing compulsions. Checkers. Checkers repeatedly check things. Oven turned off, doors locked, etc. Doubters and sinners. Doubters and sinners are afraid that if everything isn't perfect or done just right, something terrible will happen or they will be punished. Counters and arrangers. Counters and arrangers are obsessed with order and symmetry. They may have a superstition about certain numbers, colors, or arrangements. Hoarders. Hoarders feel that something bad will happen if they throw anything away. They compulsively hoard things that they don't need or use.